we are in the developing pandemic of COVID-19 coronavirus, and many of my patients with fibromyalgia and other chronic illnesses are wondering, what are the implications of this virus for me? And so what I want to do is put things in context and try to address certain questions. These are the questions that keep coming up to me that people have been asking kind of over and over again. People are asking things like, well, what about my fibromyalgia can be relevant to this disease? Am I at increased risk? Is it likely to be worse in me because I have fibromyalgia? And how do I protect myself from it? Um, and what about my other fibromyalgia treatments? What about my other comorbidities or illnesses that I might be dealing with? What's the right mindset? How can I stay healthy? Are there things that I can do to reduce my likelihood of actually getting the disease, to reduce my likelihood of actually having a worse course of it? So a little context here. As a lot of you hopefully already know, um, this is not a zombie apocalypse, and this is not Ebola virus, and this is not a disease that kills everybody that gets it. The fact is that most people who get coronavirus or COVID-19 um, don't get severe disease. The vast majority of people get like a cold or a viral infection, flu type of experience, and then it passes. Some people are asymptomatic completely, even though they actually contract the virus. And so the issue is that certain people are at increased risk, and the data that we have so far coming out of places like China and Italy is that by and large, it's people who are elderly, like 60 or 65 and older, and people who have other comorbidities or other illnesses. And the illnesses that have been shown up to be the most problematic in terms of getting people really sick or causing people to actually die from this are high blood pressure and cardiovascular disease, um, cancer, and probably people with chronic pulmonary respiratory diseases. And there's speculation about other conditions and other issues. But the data so far that we know don't show that people with fibromyalgia have any increase in problems with this. And even, some of my patients write in and they say, okay, so we know that fibromyalgia isn't formally an autoimmune disease or immunological disease, but we do know that there are immunologic changes in fibromyalgia. And so let's broaden for a second and talk about all the people with changes in their overall immune functioning. Um, Fibro is a big mixture. Some people have more prominent immune issues and some have less prominent immune issues. Some people with fibromyalgia don't have a diagnosis of autoimmune disease, but after 3 or 5 years, they seem to get one for a lot of people. So there's an immune thing going on there, but it's not a full-blown chronic autoimmune problem, and it's not an immune deficiency. I think one of the things that's showing up that's really important for us to recognize is that um, there's so much we don't know about coronavirus. And in terms of what happens when someone goes from being infected to getting like a serious full blown illness where they have to be hospitalized and maybe mechanically ventilated, the first thing is infection. And a balanced, healthy immune system probably helps people be less likely to get infected. Then there's an issue of how potent and difficult the thing gets. How sick does a person get? So why do people get sick with corona? Because there's a lot of inflammation, and inflammation causes the lung tissue to secrete fluid. Just like if you have an infection in your hand, it gets swollen. There's kind of like swelling in the lungs, and the swelling in the lungs means fluid in the tiny spaces between the lung, the alveoli where the oxygen is transferred, and where the arteries travel through the lungs. And when that space, which is very small, so that oxygen can go across in one direction, carbon dioxide in the other, when that space fills up with fluid, it doesn't transmit oxygen and carbon dioxide as well. And that's the trouble people get into. So the question is, for people who get sick with coronavirus, who is most likely to have inflammation in their lungs? And we have no idea. We just don't know. What we do know is that when we look at overall populations, we're not seeing huge numbers of people with autoimmune illness. We're not seeing huge thoughts of people um, with fibromyalgia and chronic pain. So there's not anything necessarily to worry about, like, okay, I have fibro, so I am at increased risk. Um, the important thing is really, how do you protect yourself? and how do you do things to keep yourself healthy. And and people talk about all sorts of different things. As you know, the internet's full of things about take this supplement and that supplement, blow a hair dryer up your nose to kill the virus, all kinds of things that some of them make a certain degree of logical sense and some of them are completely ridiculous. Um, all of those things notwithstanding, the thing that's most important is the precautions that the regular public health authorities are suggesting. The best way not to get infected is not to be exposed. And that's why there's so much noise about social distancing, about hand washing, about having a bottle of hand sanitizer. Excuse me, but like, hand sanitizer, alcohol. If you can't find hand sanitizer, you can get alcohol. The point is constantly cleaning your hands because we walk around, we touch things, we touch our face, small objects like coins and doorknobs and things that are hard surfaces. The virus can live on that for a half a day. We don't know exactly how long. It depends on the conditions. But the point is, the more exposure you have to people who are out there, the more likely you are to actually get the virus on your hands or breathe in the droplets. And so cutting down that exposure is the best thing we can do. Let's remember why it's so important, because if we forget this, we are at risk of getting really anxious and overwhelmed by this. It's scary what's going on. I saw a video today from the New York Times looking at all these different cities that are empty, and we can look at that and think, wow, what a tragedy. And okay, we're dealing with a crisis. But I look at those empty cities and I think, oh my gosh, that's amazing. People are taking upon themselves to protect themselves and the vulnerable people in their society. Because when you take care and you do those precautions, you're protecting the people who are most vulnerable. You're protecting the elderly, you're protecting the people with heart disease, with cancer, with lung disease, with high blood pressure, the ones who are more likely to get really sick. So it's a heroic act. And when we see like the streets empty, it's because people are mobilizing and people are caring and people are saying, you know what? I'm going to take care of myself and others. So it's a framing thing. Do I look at the circumstances and think, oh, no, this is horrible? Or do I look at the circumstances and think, okay, we have a difficult situation, but we're doing the best we can and we're doing a good job of it. Um, that's part of a broader aspect of how to actually take care of yourself. We talked about social distancing, hand washing, that's really important. If you've got fibromyalgia, the normal self-care that's important for fibromyalgia is what you should be doing now, right? Your mind-body connection, having a good state of mind, a good mindset, stress reduction, working with whatever's coming up with you emotionally so that you're not walking around in a state of grief or loss or fear or anxiety. Doing the important metabolic piece. I talk about these three things all the time. There's your mind-body connection, your metabolic biochemical world, and your mechanical structural reality. All three of those are really important to you dealing with fibromyalgia and dealing with this circumstance because it's what keeps you most healthy. So mind-body. I'll talk more about these in a second. Mind-body, metabolic biochemical, thinking about what you're eating and eating stuff that's generally healthy. It's so easy to get into a place of feeling like depressed or anxious or isolated, and then starting with the binge eating, whether it's whatever it is, if you've started to pay attention to your diet and how it affects your pain, you've probably noticed the things that generate the worst symptoms are the things that are often comfort foods, creamy stuff and baked goods and sugary stuff that feels good going down but makes you sick. It also probably has a negative impact on your immune system. So being wise about that and deciding, you know what, this is a crisis. So I'm going to be a soldier. I'm going to step up and say to myself, all right, I've learned some things about what I can do to help myself. How do I step up to the plate? Right? How do I do my mind body self care? How do I eat food that I know is good for me? And I'm talking about lean meat if you eat meat, minimal carbohydrates, but good, like complex carbohydrates and complex grains if you eat grains. Avoid gluten if you need to avoid gluten, and eating tons of vegetables, lots of greens and reds and blues and all the things that are full of antioxidants that help with the overall immune picture and oxidative stress of fibro. That's going to help your immune system as well. Last thing, your movement system. Staying active, you might have to get creative. Like if you're used to going to the gym, you might have to find a different way. So you go online and you find an online yoga class or a movement class or aerobics. There's a lot of things happening. There's a lot of people out there who have what to give in the realm of personal health, and they're giving free stuff away online. So, it's another aspect of I'm stuck at home. What am I doing? Where's my usual things that I'm used to doing? Well, get active and start looking and get creative about what can I find that's new that I didn't know about before. Oh my gosh, this guy's giving Tai Chi lessons online. Let me start to do some breathing and movement and relax my body. Ibuprofen and nonsteroidal anti-inflammatory medicines, those are really important things, right? Because there's a lot of stuff going around the internet about ibuprofen in particular. And let's put this in context. Ibuprofen is one of many different medicines that are called NSAIDs, non-steroidal anti-inflammatories. That includes ibuprofen and Midol and Motrin and naproxen and diclofenac, Voltaren. There's a whole bunch of different ones. A lot of people with pain use those. A lot of people with arthritis use those. The question is, should you stop using them because of this epidemic or this pandemic? Let's just unpack briefly. Maybe I should talk about this in another video. The French health minister came out and said, don't use ibuprofen because it can make the disease worse. It's a totally controversial topic. There's very slim evidence that it can make things worse. There's one little trial in the Lancet that was out there. I traced where he got the idea from, and it's completely circumstantial. There's no evidence that NSAIDs make it worse. Theoretically, NSAIDs could make it better. There's reasons why NSAIDs like ibuprofen could make you less likely to actually get sick. And there's reasons why they could make you more likely, and we don't know. You may have seen things coming from the World Health Organization and other sort of mainstream organizations. There was something recently at the Jerusalem Post that said, avoid ibuprofen, it's a good idea. What they're mainly talking about, those recommendations are, if you develop pneumonia that seems like it's COVID and you have fever and you want to take something to reduce your fever, probably better to use Tylenol than ibuprofen because there's not a question, or there's less question that it might do harm. If you already have chronic pain or your doctor has prescribed, look, take ibuprofen 3 times a day, stopping it right now and making yourself miserable is probably not the best thing to do. If you listen to my other stuff, you know I'm not a big NSAID fan. I barely recommend ibuprofen to anybody because of all the different side effects it can have. That's the other reason why a lot of officials have recommended, if you're starting to get sick with this disease, don't take a bunch of ibuprofen because if you do get sick and you get this whole inflammatory storm and you've taken too much ibuprofen and your kidneys are sick, that could be a problem. So bottom line, if you're using ibuprofen for another reason, like you have arthritis, you have some sort of inflammatory illness or really bad pain, you need to take a dose once or twice a day, I wouldn't stop that if you're not sick. If you get sick with something that seems like COVID, okay, there's a reasonable reason to actually stop it and use ibuprofen. I use Tylenol instead if you need something to reduce fever. Next question is coping, right? And so what I want to talk about is coping on a mental and emotional level. And I think this is like the biggest aspect that's most important once you've done the other things, because there's things we do and the ways we are, right? And your mindset is a huge determinant about this whole thing. I spoke about this a little bit before, but the suggestion is like this. Find a way to get into a headset where you realize right now is that this is not a zombie apocalypse. It's important to do precautions for the sake of taking care of the vulnerable in our community. There's an aspect that's called flattening the curve. And there's some great graphics out there, but the whole idea is like this. Um, if we prevent transmission and we reduce the number of people who are giving the virus to other people, we reduce the acceleration in the number of cases. I'm going to draw it like you. Like over time, if the cases go up really fast, then we overload our hospital systems. That's already happening in some places. I was in touch with a friend today who's an emergency responder in the New York area in Rockland County, and the system is overloaded because there are so many people who are sick and they don't know what to do with the patients. That's not a good outcome because if people who are really sick can't get care, that's bad. So That rapid increase in cases when people aren't doing social distancing is what we want to avoid. It's been proven in places like Singapore and um, and even in China, once they got their act together, when they really cranked down on the social distancing and locking down and separating people, the new cases stopped. China is not seeing any new cases because people are isolating from each other. So flattening the curve means if we reduce the amount of people exposed to each other, instead of getting a boom like that, we get a slower increase in cases, and the healthcare system can cope with it. So reframe it, right? Social distancing isn't being punished by the authorities, and it's not a loss of my personal freedom, and it's not something horrible that's happening to me. It's a conscious choice that you can make to protect your society and your community and the people you love who might be vulnerable. It's purposeful. And the reason why that's so important is because purpose helps people get through crisis. So it's really important to be self aware and notice, am I in a victim mentality? If you're feeling like you're in a victim mentality, figure out a way to get out. If you can journal about what you're frustrated about, if you can talk to a close friend, go online and find like a virtual psychologist or therapist and talk through what's really bumming you out so you can shift into a resourceful state of mind. Most of you have heard of Viktor Frankl. He was a guy who survived the horror of the Nazi concentration camp Auschwitz. And he looked at people going through that whole experience, and he found that the people who had a sense of purpose survived it. This could be a long process. This could be months where life changes a lot. So if you can find purpose in all of it, that's hugely important. First purpose, keeping our community safe. Isolation, hand washing. Second purpose, finding creative things to do. Like all of a sudden, the things we're so busy doing, you might not be able to do. So it's an opportunity to step back a little bit into your own self and start asking, well, what can I do? What do I really care about? What's that thing that I haven't been able to do because I've been so busy working and running around? Is there quality time I could spend with my kids? Is there somebody, an old friend I don't get to talk to much who I can like get on a WhatsApp video chat with and reconnect? There's plenty of ways to connect with what matters, with the people that matters. There's plenty of ways to connect with purpose, and it's so incredibly important. My friend Pesach Rothberg put out a really beautiful post recently. It was like 4 words long, but he said, drop your expectations. Okay, sorry, that was 3 words. So expectations is huge, right? Because what's stress about, what's frustration and anger and loss about is when I think things are going to be a certain way. And if I can learn to drop my expectations, if I can learn to realize, you know what, there's going to be a new normal. I've got to like release what I thought I was doing with my life and come up with a new normal and let go over and over and over again. And then we can start to be aware actually of what the possibilities are. Because it's so easy, especially if I've been coming from a frustrated, upset, scared place, right? When you get scared, when you get anxious, your mind gets focused and constricted. You stop seeing possibility. So the idea is shifting somehow inside in a way that you can have openness of your perspective, that you can actually learn to start seeing things freshly and asking, all right, life changed. What can I do that's new? What can I do that's different? What can I do to connect to something that I care about? So embracing uncertainty, getting creative, letting go of expectations. Those are fundamental aspects of reducing stress. And there's more about reducing stress. Just a brief little thing, like stress is a killer, right? On so many levels. If you got fibro, you know that stress probably makes it worse. So many people with fibromyalgia have a huge history of having an overactive stress response. Whether it's because of early life trauma, because of the pain itself, because of the illnesses, that stress response, which triggers other different physiologic changes and worsens fibro symptoms and actually potentially worsens the actual disease of fibromyalgia. And so getting into a quiet, calm space and learning how to find some sort of technique to cut through stress on a regular basis can be incredibly important. If people are interested in this, I'll like do a little online free thing. So leave some comments, leave something to let me know that that's interesting to you, and I'll be happy to try to share. Um, What I want to add to that is there's a lot of techniques and a lot of easy things to do. There's a lot of people who are right now online giving free courses in meditation and mindfulness. Look it up and find it. Um, I want to distinguish two kinds of meditation practice. This came up in a conversation I had recently with someone who has a good kind of regular get quiet in the morning for 15 minutes, but then spends the rest of the 16 hours of the day like running and kind of freaking out about stuff. One of the most powerful things you can do is something called the pause. And the pause is really simple. The pause means that when you need it, or maybe when you don't need it, stopping what you're doing. When you start to notice the tension building, when you start to notice that you're getting into a bad mood, when you start to notice getting irritated, or your neck starting to get tense, or your back starting to get tense, stopping and checking in with what's your experience. What is your physical sensation like? Are you holding tightness in your jaw? Are you holding tightness in your back or your neck? What's your emotional experience? What are the feelings? Are you feeling frustration and anxiety or fear? Are you feeling irritation? And just acknowledging what you're feeling and seeing if you can just let go of it a little bit. Make a little space around it. Noticing what your thoughts are. Are your thoughts spinning around in a irritated, frustrated, aggravated, judgmental mode? Acknowledging, dropping those thoughts, starting over, doing that during various courses of the day. A lot of my patients and clients, I recommend they set an alarm, like every hour pause. The pause takes literally, could take 4 seconds, it could take 4 minutes. It's really up to you. So if you're busy when your alarm goes off, you pause for 4 seconds. That was a pause. I just released the tension in my neck and my back in like 3 seconds. You can learn to do that. You just have to start practicing it. Let's talk about social connection a little bit because we're social creatures. And I mentioned it before, but it's one of the most stress relieving things you can do in the world. Talk to people you care about, listen to people you care about, be there for other people. Take 20 minutes a day and say, I'm going to take 20 minutes and be there for other people. Drop my agenda completely. Selfless giving is so empowering. It's purposeful. It's stress relieving. It gives you something to feel good about. Call your grandmother and ask how she's doing, and just ask if she needs anything. Call your friend's grandmother, or call the person around the corner who you know doesn't have any relatives. Be in touch with somebody in a safe way and give a little bit of your time. Give a little bit of your heart. Open your heart to somebody else. These are powerful things. They shift your physiology. Stress physiology is a constricted physiology that helps you to get sick. And physiology of gratitude and giving is a physiology that helps you get well. Last thing just to talk about is other habits like sleep and food and substances. It's really easy to go downscale. It's really easy to not sleep, to binge watch Netflix and like kung fu movies until 2 o'clock in the morning. It's really easy to start eating comfort foods. It's really easy to use tobacco and drink because you know what? I'm stuck at home and it's boring, or I'm scared. Alcohol and tobacco are two of the most toxic substances you can take. If you want to increase your chances of getting infected, get drunk and smoke a pack of cigarettes, or not. Really, that's my advice. Um, there's a lot to say about supplements, but there's also a lot of confusion. So I'm not going to go there right now. I hope this has been helpful. I'm here to respond to your questions, to your needs. If this talk has brought up questions or concerns, share them with me. You could send a PM, you could put it in the notes here, you could share this video with other people. Thanks, you'll have it. I appreciate that. And I'm here to be of service. There's going to be a link below the video if you want to get more information in general about fibromyalgia and how to cope with it, how to work with it, how to heal through a combination of conventional medical understanding and natural healing. You can join my online email community, and no spam there, just good stuff, hopefully. So thanks for being here, and I look forward to showing up for you again. Take care.